Hello everyone, I am Dr. Pankaj Kumar Sonar. I am a senior consultant in GI Oncosurgery at Narayana Hospital, Howrah. We all know that October is designated as the Liver Cancer Awareness Month, and in this month we speak about liver cancer. So our topic for today will be liver cancer. So what is liver cancer? We all know that liver is a very important organ of our body and it is situated in the right upper abdomen. It does a number of functions for our body, and sometimes when the liver cells become abnormal, they result in formation of a liver cancer. So generally, most often liver cancer is a disease in which there are two diseases which exists in a single one. The background liver gets affected, and that is known as cirrhosis. So the liver is damaged, and in this backdrop a cancer develops. So basically when we talk of liver cancer, basically we are dealing with two cancers in the same organ. One is the organ getting damaged in the form of cirrhosis, and the second one is cancer appearing in that diseased organ. So the question which comes in our mind is, what are the symptoms of liver cancer? Liver cancer as such may not result in any symptoms, or it might be vague, like an upper abdominal pain or some weight loss which is unintentional, or a derangement of the liver functions, so things like that. Basically the symptoms might be those of the deranged or the diseased liver, as I was speaking about earlier, that is cirrhosis of the liver. Most of the symptoms might be related to the cirrhosis of the liver, like jaundice or increased fluid in the abdomen, which we call ascites, or things like that. So liver cancer per se may not have a distinct symptom of its own. The symptoms may be manifested because of the background liver disease or cirrhosis of liver. So the next question which comes to our mind is, how do we come to a diagnosis of liver cancer? What are the tests which a doctor orders or performs to come to or arrive at a diagnosis of liver cancer? So there are certain blood tests like liver function tests. There are certain imaging studies like ultrasound of the abdomen or CT scan or MRI, which helps us to know in details about the location of the tumor within the liver and whether the tumor has spread beyond the liver into other organs or into the blood vessels, etc. Among the other tests which I have already said about which we perform to come to arrive at a diagnosis of liver cancer, we should include biopsy as well. In certain cases, when the imaging studies are not giving us a definite result, in which we are not sure whether a mass which is present in the liver is a cancer, in such situations we take the help of biopsy, where we obtain tissue from such mass and we see it under microscope, and then we come to the diagnosis of liver cancer. What do we do after this? So what are the treatment options which are available to a patient when liver cancer has been diagnosed? So there are multiple options which are present right now. A doctor, a hepatobiliary surgeon or a liver transplant surgeon who generally deal with such situations, they can prescribe surgery. It will depend upon how healthy the liver is, what are the number of tumors, whether the tumors have spread beyond the confines of the liver into other organs or into the blood vessels. So surgery is definitely a mainstay of treatment in which we can remove the tumor, and we all know that liver has got a unique power or potential to regrow. So after resection, there is every chance that the liver might grow back to its original condition. It also depends upon what is the background situation or background disease which is present in the liver, like cirrhosis of the liver. The other options which are available at hand are ablative therapies. Ablative therapies are not done by surgeons, they are generally done by intervention radiologists, in which a tumor is burnt. We can take the help of radiofrequency ablation or microwave ablation, in which we can destroy the tumor. Such procedures are not surgery exactly. In this, minimally invasive techniques are used, and in which we can burn the liver. Apart from that, we have got therapies like in which we block the arterial supply or the nutritional supply to the tumor. This can also be done by intervention radiologist, in which we inject chemotherapeutic agents into the vessels which are supplying the tumor, which ultimately results in death of the tumor. Apart from this, we have got chemotherapies, immunotherapies, targeted therapies. So nowadays for liver cancer, we have got a whole armamentarium of options which are available, and definitely such cases require a discussion in a multidisciplinary meeting in which people from doctors from other specialities are also involved, and then they come to a consensus as to what is the best treatment which we can offer to these patients. We cannot say that surgery is the only form of treatment available. There are other forms of treatment available in which we can give the best results to the patients. And we definitely have to mention the importance of liver transplantation in such situations in which surgery, that means resection of a part of the liver, or ablative therapies are not going to be sufficient, in which we find that replacement of the entire liver with a new liver is the only hope for the patients, and definitely it can also cure the disease. So liver transplantation has got a huge role in treatment of liver cancers. So for any cancer, as we all know, that there is a post-operative follow-up which is required. So in case of liver cancer also, we have to adhere to strict post-operative protocols for post-operative follow-ups, because the main concern, as is for any other cancer surgery, is whether the tumor is going to come back, whether it is going to recur. So definitely the doctor is going to prescribe a number of tests which have to be done at regular intervals, which will include blood tests, imaging studies, etc. And a patient has to undergo definite follow-ups in the clinic, and then so that if we get any information about recurrence of the disease, we can resort back to various treatment options which are possible in order to cure the disease and to prolong life. So post-operative follow-up is a very important part in the management of such tumors. And for other situations in which, suppose the tumor has resulted because of hepatitis B or hepatitis C related infections, we need treatment for hepatitis B and hepatitis C so that the tumor doesn't recur. In situations in which liver transplant has been done, definitely post-operative immunotherapy and immunosuppression, they are going to be a very important part of the treatment. So I like to conclude by saying that, as I have already mentioned, that liver cancers generally most often happen in the background of a diseased liver, that is cirrhosis of liver, and we all know what are the causes of cirrhosis of liver. The leading cause is definitely alcohol, non-alcoholic fatty disease, hepatitis B, hepatitis C. So in our awareness, we also have to understand the importance of a correct lifestyle in order to prevent all these diseases like alcohol related liver disease or non-alcoholic fatty liver disease, immunization against hepatitis B, proper treatment of hepatitis C, because these are going to be very important in prevention of these diseases. So the awareness should not only be about what happens when the disease is actually present in your body, how to deal with the condition once it has happened, but also how to prevent this disease by correct lifestyle and by adhering to immunization policies and treatment of hepatitis C infection. Thank you very much.